I could feel it myself after upping my omega-3. I felt as my cognitive abilities had improved greatly. So this is a summary of different studies that omega-3s are highly effective to reduce major depressive order, and also helpful for bipolar disorder as well. So omega-3 were very helpful in treating ADHD. It was a small study, but still very significant, over 8 weeks. But this is a dose that, it's very interesting. This is a dose that's similar to most of the Japan population. So it's not harmful because almost everybody in Japan eats high amounts of omega-3. And of course, when I went to Japan, you get breakfast fish, lunch fish, dinner fish, snack fish. So you better like fish in Japan, but it is greatly helpful in having good brain function. So what they did is they put all these children who are not in Japan on the same dose of omega-3 that people ordinarily ate in Japan, and they found that there was in the baseline, the people who had low omega-3 had much more severe attention deficit hyperactivity. And after taking this dose, which is a very high dose, there was significant improvements in inattention, hyperactivity, oppositional defiant behavior, and conduct disorder, all improved with the omega-3. CDP-Choline is something I've been recommending for quite a while. The C is the a cytosine, which is one of the bases of RNA, diphosphate here, and choline on the end. So it's very connected with brain health. So its major physiological biochemical effect, it inhibits phospholipase A2. And this was a big deal in the COVID epidemic because the COVID causes increase in PLA2. So many physicians were using this in their patients and had very good results with controlling COVID by using CDP-Choline. And it's also been used, and it's helps produce lecithin, and so it's been very useful for stroke and head injury. Sorry about that. And it also restores the concentration of lecithin. If lecithin gets too low, and it may also, the decreasing phospholipase A2 leads to a reduction in arachidonic acid, which causes severe inflammation. So these are the diseases. So virtually all the brain diseases are associated with high phospholipase, which can be reduced by CDP-Choline. So a large number of the viruses, Clostridia, Candida, brain and spinal injuries, pancreatitis, so just a huge number of illnesses, and also sepsis, which is a fatal disease where your infection becomes too high. It would be something that should be considered as a very simple treatment for sepsis. It's also been shown to improve Alzheimer's disease, And, and very few of the drugs for Alzheimer's work for any significant length of time. So even the best drugs are just slightly effective in reducing Alzheimer's scores. So the mental state scores were improved using this. Orientation subtests significantly improved. Cerebral blood flow improved. And so looks like a good, something good you could take to improve Alzheimer's if you have it, but also I suspect that it may help to stop Alzheimer's from developing because of controlling an increase in phospholipase A2. So in this study, patients were given 500 milligrams twice a day, and there was significant improvement in 3 different tests of impairment: the mini mental state exam, the activities of daily living, and the instrumental activities of daily living. It's found that even in individuals who have the harmful type of ApoE, so the worst type is gives greatest risk factors ApoE4, and so all the different types of people with different types of ApoE were improving with the use of CDP-Choline. It's also found that CDP-Choline is neuroprotective for strokes and dementia, and it helps with different neurotransmitters, and it's also thought to be helpful for the cocaine addiction, just like cholesterol. So it decreases the craving for cocaine. So a lot of the drug addiction appears to be due to not having good brain nutrition. So the person is craving cocaine to help to try to self-medicate to improve their brain function. So it's been CDP-Choline helping both with bipolar disorder and cocaine dependence, improves memory, and it's may also help with alcohol and cannabis addiction. So, we've had over the last years more and more states legalize cannabis, and Dr. Amen, very famous psychiatrist, says this is one of the worst things we've ever done, that when doing brain scans, he's found that people who are high users of cannabis have very poor brain structure. And 2,000 milligrams would be suggested for people with addiction issues. So benefits of CDP-Choline: helps to produce additional phospholipids, increases brain metabolism, helps increase norepinephrine and dopamine. So lots of benefits, but probably one of the main things is inhibiting this toxic phospholipase A2. The type of CDP-Choline used is a formula called cognition. It's the highest quality, standardized, pure and potent form of CDP-Choline available. It's been used in multiple clinical trials of CDP-Choline, which found it to be useful as a cognitive enhancer and very safe. So these are the different levels. Just boosting cognition and memory, 250 to 1,000. Age-related cognitive decline, 1,000 to 2,000. Alzheimer's, 1,000. I would think maybe 2,000 would be better because of the severity of the disease. Depression, drug addiction, and stroke, 2,000 to 2,500. Glaucoma and amblyopia, which eye disorder, 1,000 milligrams. And if you have a phospholipase test available, you could keep using it until the phospholipase becomes normal. So the different supplements that help to improve different disorders. So depression has been treated with increased cholesterol, omega-3, B12, folate, B6, and multivitamins. Memory and cognition from improved again by cholesterol, CDP-Choline, omega-3s, phosphatidylserine, and remember that's in the focus mate, and also nutritional lithium. So nutritional lithium is completely different than pharmaceutical lithium. It's a very tiny dose. It's like the pharmaceutical lithium is like 100 or more milligrams of lithium, whereas it's the amount that New Beginnings is 1 to 4 milligrams of lithium. So it's a tiny dose. As a matter of fact, it can't even be, it can only be detected by it's so low you can only detect it by the mass spectrometer. You can't even detect it by the test that's done in the hospital, on a blood sample. It doesn't even show up. So you don't have to worry about toxicity. ADHD, omega-3s, carnitine, magnesium B6, phosphatidylserine, which of course a lot of these are found together in focus mate, another one that I take on a regular basis. Addiction, cholesterol, and CDP-Choline can help the person recover from addiction, and I would presume prevent them from becoming addicted to begin with. Brain repair and recovery, like in brain damage or stroke, CDP-Choline and cholesterol. Homocysteine, folate, B12, and B6 are very helpful. So everyone should get a homocysteine test. It's a relatively inexpensive test, and it's very important for your brain. So it's something you need to invest in.